Glaucoma, the silent thief of sight, remains a major public health concern in Nigeria. Every year, thousands of people lose their vision to this preventable but irreversible disease. In commemoration of World Glaucoma Week 2025, the Federal Ministry of Health and Social Welfare led an awareness walk in the heart of Abuja to highlight the importance of early detection, regular eye screenings, and access to treatment. With this year's theme, Uniting for a Glaucoma-Free World, See the Future Clearly, health experts, government officials, and stakeholders have come together to call for urgent action in the fight against blindness caused by glaucoma.
You can do surgery, glasses, and refractive error, you can have vaccines. Even corneal problems, you can get a corneal transplant. But for glaucoma, once you lose vision is lost. Now, if you come in and you have a diagnosis of glaucoma, it is the vision that you still have that we can hope to preserve.
The walk was followed by a ministerial press briefing at the Federal Ministry of Health and Social Welfare. The Honorable Minister of State for Health, Dr. Iziaq Salako, led the discussion, emphasizing the gravity of the situation.
The man seated before you, talking now, is a victim and is also a patient of glaucoma. You will not believe. It is the second commonest cause of blindness and leading cause of irreversible blindness worldwide and in Nigeria. However, it is manageable with early detection. Glaucoma is reported to affect an estimated 60.5 million people worldwide, about 87% of which are living in developing countries. The Nigerian Blindness and Visual Impairment Survey in 2005 to 2007 reported that over 4.2% of Nigerian population were blind. 16.7% was due to glaucoma. The risk factors associated with glaucoma include African ancestry, which means virtually all Nigerians are at risk, and increasing age of over 40 years. Additional risk factors include the family history of glaucoma, elevated high pressure, medical condition that predisposes a person to glaucoma, such as diabetes and hypertension, refractive errors, eye injuries, thin corneas, and prolonged use of corticosteroid eye drop.
The Federal Ministry of Health has been proactive in addressing this issue. In recent years, it has rolled out several key initiatives, including the National Glaucoma Screening and Treatment Guidelines, which were developed and distributed across all states to standardize glaucoma diagnosis and management.
More recently, the Ministry, following a rigorous and collaborative process, developed and launched the National Glaucoma Screening and Treatment Guidelines. These guidelines have been distributed to all states of the Federation and the Federal Capital Territory. Last year, ophthalmologists from all the states of the Federation were trained in the use of the guidelines to step down the training in their respective state and health facilities. To tackle this, the Federal Minister of Health and Social Welfare, through the National Eye Health Program, is implementing, on behalf of Mr. President, the Effective Coverage Initiative, known as Jigibola 2.0. The initiative was aimed to provide free vision screening and distribute over 5 million pairs of reading glasses free to Nigerians in the next 3 years.
So far, over 100,000 Nigerians have been screened, with 80,000 spectacles already distributed. Through Jigibola 2.0, the government aims to improve vision, productivity, and overall quality of life, especially for those in rural communities.
Ladies and gentlemen, with this mind, you will agree with me that the theme for the commemoration of this year's World Glaucoma Day, Uniting for a Glaucoma and Free World, See the Future Clearly, afford us both in the public and private sector the opportunity to save over 400 million eyes of Nigerians, improving quality of life, which will sustain much needed economic growth and development.
As Nigeria joins the world in observing World Glaucoma Week 2025, the message is clear. Glaucoma is preventable, but only if we take action. Regular screenings, timely treatment, and proper awareness can save millions from avoidable blindness. Together, we can create a glaucoma-free future. See the future clearly. Get tested today.